How can you understand complex urine cytology report terms? Imagine trying to read a foreign language that holds the key to your bladder health. That's what understanding a urine cytology report can feel like at first. But don't worry, it's based on clear scientific principles. Urine cytology is a lab test that looks at cells in your urine under a microscope. Its main goal is to find abnormal or cancerous cells that might come from your bladder or urinary tract. This test is often ordered if you have symptoms like blood in your urine or other signs that could suggest bladder cancer. The process begins with collecting a urine sample, which is then spun in a machine called a centrifuge. This spins the urine to concentrate the cells into a pellet. The lab then stains this pellet and places it on slides for a specialist called a cytopathologist to examine under a microscope. They look for different types of cells, including normal bladder cells, immune cells, bacteria, or abnormal cells. Abnormal cells can be reactive, meaning they change due to infection or inflammation, or they can be precancerous or cancerous. To make sense of what they see, labs often use a system called the Paris system for reporting urinary cytology. This system classifies findings into categories. For example, if the report says negative for high-grade urothelial carcinoma, it means no cancer cells were found. If it says atypical urothelial cells, it means some cells look unusual but it's not clear if they are cancer. Suspicious for high-grade urothelial carcinoma suggests a higher chance of cancer, and positive for high-grade urothelial carcinoma confirms the presence of cancer cells. There are also categories for low-grade tumors and benign findings. Understanding the specific terms used in the report can help you grasp what the results mean. For instance, the nuclear to cytoplasmic ratio refers to how big the cell's nucleus is compared to the rest of the cell. A high ratio often indicates abnormal or cancerous cells. Hyperchromasia means the nuclei stain very dark, which can be a sign of increased DNA content typical in cancer. Pleomorphism describes variation in cell or nuclear size and shape, another feature of malignancy. Increased cell division, called mitotic figures, can also suggest cancer activity. Sometimes, cells show atypical degeneration, which means they look abnormal but might not be cancer. When your report states that no high-grade cancer was detected, that's generally good news. But if it mentions atypical or suspicious cells, it means further testing is needed. Additional procedures like cystoscopy, where a doctor looks inside your bladder with a small camera, are often recommended to confirm the diagnosis. It's important to remember that urine cytology is more sensitive for detecting high-grade, aggressive bladder cancers than low-grade tumors. It's a valuable screening and monitoring tool but not a standalone diagnostic test. If you receive a complex report, don't hesitate to ask your healthcare provider to explain what each term means for your health. Remember, abnormal results often lead to more tests to get a clear picture. Factors like infection or inflammation can sometimes cause cells to look abnormal, so context matters. Always discuss your results with a medical professional who can interpret them in light of your overall health and symptoms. In summary, understanding urine cytology report terms involves knowing the categories used, recognizing cellular features like nuclear size and staining, and understanding what these findings imply for bladder health. Each person's situation is unique, so personalized medical advice is essential. Keep in mind that these reports are pieces of a larger puzzle, and your healthcare team is there to guide you through what the results mean and what steps to take next.